This is a proposal for the New Mexico Department of Health by Lauren Hogan regarding vaccine coverage in Santa Fe. Childhood vaccines are a crucial factor in public health. They protect against 12 different diseases, including measles, tetanus, and mumps, just to name a few. They prevent an estimated 2 to 3 million deaths per year. Without adequate vaccine coverage, these diseases can make a resurgence, meaning that higher numbers of people can become infected with these diseases. Vaccine coverage in Santa Fe has a lot of room for improvement. In order to improve vaccine coverage, we need to address the barriers that prevent children from receiving their vaccines. When we say coverage, we're referring to a percentage of a demographic that has received all of their recommended vaccines for that target demographic. It basically means how many people are on schedule with their vaccines. Improving vaccine coverage is crucial for staving off possible resurgences of immunizable diseases. The more people that are vaccinated, the less hosts there are for a disease. Vaccine exemption rates hover between 2 to 3%, but the coverage rate for Santa Fe County is only around 85%. This means that at least 10% of children are not on schedule for their vaccines, but are not legally exempt from them for medical or religious reasons. This unaccounted gap in vaccine coverage is what we need to address. So what's causing this gap? First, there are geographical barriers that need to be addressed. There's only one public health office in Santa Fe that offers open vaccination clinic days, located on Latrado Street in Santa Fe. But this office is a 20-minute drive from the south side. If you don't have a car and you're taking the bus from the south side, there are 2 separate routes that need to be taken, and the travel time is about an hour, assuming you're lucky enough not to miss any of your connections. A lot of people may think that the inconvenience of traveling to get their child's vaccinations outweighs the benefits. There are also economic barriers that interfere with the administration of vaccines. A person covered by Medicare will, fortunately, have no copays or out-of-pocket costs to get their child vaccinated. Those covered under private insurance might pay as much as $242 or more for the first year of vaccinations for their new baby. And if you're one of the 422,000 uninsured New Mexicans out there, you can expect to pay about $620 out of pocket for the first year of shots, and a total of $1,170 for all the adolescent shots your child will need. If we do nothing to remedy these barriers, and a significant portion of kids continue to go on unvaccinated, preventable diseases can make a resurgence. So, what's the solution to this problem? I propose that we bring the vaccines to them. Santa Fe does have a mobile health clinic for health screenings and flu shots, but there's no dedicated circuit for vaccines, particularly childhood vaccines. A low-cost mobile vaccine clinic would improve accessibility to vaccines for lots of residents. It would be more convenient for families that have difficulty staying on top of vaccine schedules, and would bring more attention to the importance of vaccines. So, how do we do it? First, we need to determine what kind of vehicle and supplies we will need in order to run the vaccine clinic. Next, we need to decide who's going to run it. We need to find and train suitable employees. Next, we need to establish where to implement the vaccine circuit by determining the most efficient routes possible. And finally, we need to let the public know how they can take advantage of this new service by advertising the mobile clinic as effectively as we can. As far as equipment goes, a moderately sized van or a small trailer would be an economical way to travel to established clinic locations. A medical-grade fridge and freezer, along with a generator to power them adequately, or another suitable medical-grade vaccine cooler, would be necessary for proper vaccine storage. Folding tables, chairs, and an overhead canopy would make it easy to set up a clinic area just about anywhere in town. Additionally, a laptop or a tablet, a printer, and a wireless hotspot would assist in on-the-spot accessibility to shot records, as well as the ability to print them for patients anywhere at any time. In regards to staffing, additional medical staff, such as medical assistants or clinical nursing assistants, may be needed to support the clinic, depending on how frequently the clinic operates and how many patients it processes. There must be one quality assurance employee delegated to ensuring that vaccines are handled and stored properly. At least one attending physician should be present in case there are any adverse effects or reactions in response to an immunization. The mobile clinic could be an excellent opportunity for medical or nursing students to get sufficient practice administering inoculations, as well as a great opportunity for community volunteers. But regardless of who's running the clinic, all personnel should be trained in sharp safety and bloodborne pathogen training. Determining the most effective routes for the mobile clinic could be done by surveying Santa Fe in order to establish parts of town where geographical and economic barriers are particularly cumbersome, as well as wherever the largest gaps in vaccine coverage are. By setting up clinic days at public locations near these gaps, such as in front of libraries, parks, or large parking lots, like over by Santa Fe Place, we can significantly improve accessibility to vaccines. We can also offer back-to-school immunization clinic days near public schools or partner with the schools to offer them in the buildings themselves. Finally, advertising the mobile clinic effectively will help ensure that more people that need assistance with vaccines will take advantage of this program. In the case of clinic days at schools, announcements at the school should be made well in advance so that students, staff, and parents are aware. Reaching out to local news broadcasts for a segment would be an excellent way to convey why we are doing this, the importance of staying on top of your children's vaccines, and information on where we will be conducting the clinic. Airing a PSA on a local TV channel or radio station would also be a good way to spread the word. Now to the budget breakdown. The cargo van would run us about $30,000. If we want a nice paint job, it'd be more like $32,000. A fridge and freezer will run us $1,150, and the generator to power them would run us another $1,000. An outdoor canopy, 2 folding tables, and 8 folding chairs would run us $400, and a 30-second commercial airtime averages around $1,500. So the total estimated cost to get us off the ground runs about $36,050. But the costs of the program pale in comparison to the benefits of it. By implementing a mobile vaccine clinic, we will improve accessibility to necessary vaccines, meaning better vaccine coverage in Santa Fe. Improving coverage means that we strengthen the community's herd immunity. Vaccines don't just protect the vaccinated. The more people that get vaccinated, the less hosts and reservoirs there are for the disease to live in, which means that people who can't get vaccinated can still be protected from the disease. Additionally, the mobile clinic will bring community attention to the importance of immunization. The bottom line? This project will literally save lives in our community. So, in conclusion, vaccine coverage in Santa Fe needs improvement. Coverage can be improved by addressing geographical and economic barriers in town, and a low-cost mobile vaccine clinic would improve accessibility to vaccines, improving coverage and improving herd immunity in Santa Fe. Thank you so much for your time and consideration.